Hi, I'm Dr. Clara. Most women think perimenopause begins with hot flashes. That's actually one of the biggest myths in women's health. It often starts years earlier, with symptoms that look exactly like stress, anxiety, poor sleep, allergies, joint pain, or constant fatigue. If any of those sound familiar, you're in the right place. In this video, I'll walk you through the hidden early signs of perimenopause, explain the science behind them in simple terms, and share practical, evidence-informed steps that may help you better understand what's happening in your body. By the end of this video, you'll be able to recognize these early signs with confidence. Let's get started. Sarah was 37 the first time it happened. She woke up at 3 a.m., heart pounding, wide awake for no reason at all. No stress before bed, no bad dream, nothing she could point to. Just her body sounding an alarm that nobody had ever warned her about. She lay there wondering what was wrong with her. Was it anxiety? Was it just stress from work? She didn't know it yet, but her body wasn't malfunctioning. It was simply starting something early. If any part of Sarah's story sounds familiar, stay with me for the next few minutes, because what happened to her is more common and starts much earlier than most women are ever told. Here's what almost nobody tells you. Perimenopause doesn't wait until you're 50. For a lot of women, it quietly starts in the late 30s, up to 10 years before anyone even mentions the word. And it doesn't start with hot flashes. It starts with strange little things that don't add up. Things doctors dismiss as stress. Things you dismiss as just getting older. Today, I'm walking you through 5 of these unheard of early signs, the ones no one warns you about, what's actually happening in your body, and what you can do about each one. I want to be honest with you for a second. Too many women spend years being told it's just anxiety or just stress, bounced between specialists, handed prescriptions that don't fit the real cause. Some don't get an answer for 5, 6, even 8 years. That's not okay. And it's exactly why this video exists, so you can recognize what's happening before you lose years wondering what's wrong with you. Let's go back to Sarah for a moment, because her 3 a.m. panic wasn't random, and understanding why it happened is the key to understanding everything else in this video. In your late 30s, your body starts skipping ovulation some months without you ever noticing. No ovulation means very little progesterone, and progesterone is the hormone that calms your nervous system. Think of it as your body's natural off switch at night. When progesterone drops, that off switch gets weaker, and your brain can send out sudden bursts of adrenaline in the middle of the night for no clear reason at all. That's not a panic disorder. That's not something wrong with your mind. That's hormonal. If this sounds like you, here's what actually helps. Research points to magnesium glycinate as supportive for this calming pathway, along with keeping your blood sugar stable before bed, which means avoiding late sugar or alcohol that can spike and crash overnight. But here's the most useful thing you can do. Track whether these wake-ups cluster in the 7 to 10 days before your period. That pattern alone, written down and brought to a doctor, turns a vague complaint into something they can actually act on. Now here's a symptom almost nobody connects to perimenopause. Wine that never bothered you before suddenly gives you hives. Your sinuses flare up for no reason. You develop a sensitivity to foods you've eaten your whole life. This feels random, but it isn't. Estrogen actually triggers histamine release in your body, while progesterone normally helps clear that histamine out. When progesterone drops while estrogen is swinging up and down, histamine builds up faster than your body can clear it. That shows up as skin reactions, congestion, or food sensitivities that seem to come out of nowhere. If you're noticing this, some women find real relief by tracking histamine-heavy foods, things like aged cheese, wine, and fermented foods, especially in the second half of their cycle. And if you notice your allergy symptoms seem to follow your monthly cycle, that's worth mentioning specifically to your doctor. It's a detail almost no one thinks to report, and it can completely change the direction of a diagnosis. Let's talk about something else that catches women off guard: a stiff shoulder that won't loosen up. Achy knees on the stairs that weren't there last year. You're 38, and you're wondering if this is just what getting older feels like. Here's what's actually happening. Estrogen acts as a natural anti-inflammatory for your joints and connective tissue. It's like a cushion. As estrogen fluctuates during perimenopause, that cushioning effect weakens, and joints that were perfectly fine last year suddenly aren't. The evidence-based options here are simple. Omega-3s and consistent low-impact movement, things like walking or swimming, have real research support for reducing this kind of inflammatory joint symptom. And before you accept an early arthritis label from anyone, it's worth asking directly whether hormonal fluctuation could be part of the picture. That one question can save you years of chasing the wrong diagnosis. Symptom 6, the fatigue. No amount of sleep fixes. There's one more piece of this puzzle that almost never gets mentioned, and it might be the most surprising one yet. Some women in their late 30s start noticing a strange kind of fatigue. Not the "I stayed up too late" tired, a deeper, heavier exhaustion that sleep doesn't seem to fix, even after 8 full hours. What's actually happening? Here's what's actually happening. As progesterone and estrogen begin their unpredictable swings, your adrenal glands, the small glands that manage your stress hormones, start working overtime to compensate. Over months, that constant compensation leaves you running on a lower reserve of energy, even on days when nothing stressful happened at all. It's not laziness, and it's not depression. It's your body quietly working harder behind the scenes just to keep things balanced. What helps? If this sounds familiar, the good news is that this type of fatigue often responds well to consistent basics done right. Stable blood sugar throughout the day, rather than relying on caffeine to push through. Short walks, especially outdoors, which help regulate cortisol naturally. And protecting your first hour of sleep, since that's when your deepest, most restorative sleep cycle happens. If you're waking up during that first stretch of the night repeatedly, that's worth mentioning to your doctor specifically, not just brushing off as bad sleep. You're not overreacting. And here's something worth saying clearly. A lot of women read a list like this and immediately start Googling worst-case scenarios. I want to gently pull you back from that. Every single symptom we've covered today has a clear, explainable biological cause. None of it means something catastrophic is happening. It means your hormones are shifting, your body is adjusting, and that adjustment period, while uncomfortable, is temporary and completely normal. You've done this before. Think about it this way. Your body has navigated hormonal shifts before. Puberty, pregnancy, postpartum, and it came out the other side each time. This is simply the next transition, and just like those earlier ones, it has a beginning, a middle, and an end. What actually makes the difference? What separates the women who move through this feeling confident from the women who spend years feeling lost isn't luck. It's information, and it's advocacy. Knowing what to track, knowing what questions to ask, and trusting your own experience, even when someone tries to tell you it's probably nothing. And the most important thing you can do right now? Start paying attention. Write down what you're noticing, the sleep patterns, the energy dips, the moments that feel off. Not because something is wrong with you, but because you are worth understanding. This stage of life has been under-researched, under-discussed, and too often dismissed. But that's changing. And women who know what's happening in their own bodies are leading that change. You are not falling apart. You are in transition. And there is a real science-backed path through it, one that starts with exactly what you did today, choosing to learn. So give yourself some credit. You showed up. You paid attention. That already puts you ahead. The next chapter isn't a decline. It's a different kind of strength, and you are more than ready for it. Quick summaries. So far, we've covered night waking, histamine reactions, and joint pain, and the fatigue. No amount of sleep fixes, All 4 can share the same underlying hormonal changes. Before we finish, here's the key takeaway. The core takeaway. If there is one thing I want you to take away from today, it's this. You are not crazy, you are not lazy, and you are not just getting old. Your body is communicating with you. These early signs, the 3 a.m. wake-ups, sudden food sensitivities, joint stiffness, aren't random breakdowns. They are biological responses to shifting hormones. Your actionable game plan. So, what can you start doing today to take control? Step 1. Track, don't guess. Use a simple app or notebook to log your physical and emotional symptoms alongside your monthly cycle. Look for patterns, especially in the 7 to 10 days before your period. Step 2. Support your nervous system and joints. Focus on stable blood sugar, prioritize quality sleep, consider magnesium glycinate and omega-3s, and keep moving with low-impact exercise. Step 3. Self-advocate. Take your symptom logs to a health provider who listens. You don't have to wait until hot flashes hit or until you're 50 to get real help. Perimenopause is a transition, not a sentence. The earlier you know what's happening, the sooner you can get back to feeling like yourself. If this video helped connect the dots for you, please share it with a friend, sister, or colleague who might be silently suffering through the exact same thing. Don't forget to like, subscribe, and drop a comment below telling me which of these signs surprised you the most. Thank you for watching, take care of yourselves, and I'll see you in the next video.